This is the Femax set of dilators, which comes in this discreet case that looks a bit like a spectacle case. Inside are the set of dilators. When you get the dilators out, you will actually see the largest one first, which sometimes can alarm ladies. There are 4 dilators in the set, and they fit inside each other a bit like Russian dolls. They actually fit together in 2 pairs just by simply screwing them together. So that's the first set, and the second set go together exactly the same. Also in the case there are 2 samples of vaginal lubricant. When using the dilators, it's important to try and be as relaxed as you can. So try and make sure that you're not going to be disturbed, that you're in a private place, and also that you've got time to use the dilators. If you're rushing around, then you're probably going to feel quite stressed, and this isn't the ideal time to use the dilators. Some ladies find that having a nice relaxing bath beforehand can help their relaxation. A variety of positions can be used to use the dilators. Most ladies prefer lying on their back on their bed and then bringing their knees up slightly apart and inserting the dilator into the vagina that way. Other ladies though can use a squatting position, or some ladies prefer to put one leg on a chair or the bed and dilate that way. It is really important to use some kind of vaginal lubricant when using the dilators. This lubricant should be water soluble, and a small amount should be put on the end of the dilator and also just into the vagina by using your fingers. A lot of ladies worry that they're going to cause some damage by using dilators, but as long as you use a firm but gentle pressure when inserting the dilator and just insert it as far as it will go into the vagina and don't try and push or force it, then everything will be fine. If you've had radiotherapy, once you've inserted the dilator, it is important that you move the dilator in the vagina from side to side and also forwards and backwards. The idea of this is to try and stop any scar tissue forming within the vagina. As you can see, there are 4 sizes of dilators. We would advise you to start with the smallest dilator and then gradually progress through the sizes as you feel ready. Normally each dilator is inserted for 5 to 10 minutes at a time. Some ladies do experience a very small amount of vaginal bleeding after using the dilators. If this happens, don't panic. If, however, the bleeding becomes heavy, or if you notice any vaginal bleeding at times when you haven't been using the dilator, then please consult a health professional. To clean your vaginal dilators after each use, they need to be washed in warm soapy water and then dried thoroughly, and then they can be stacked inside each other for storage. You will be advised how often to use the dilators by your health professional, and the dilators can also be used in conjunction with having intercourse.
Radiotherapy, both internal and external treatment, may cause scar tissue to develop within the vagina. This scar tissue can be very thin to begin with, and if it's not broken down, may become more permanent as the months go by. If scar tissue develops, then you may notice that sexual intercourse becomes more uncomfortable, or it becomes more difficult to examine your vagina or cervix, and this may be very important for your routine follow-up following radiotherapy. Scar tissue may be minimised by the use of vaginal dilators or by regular intercourse. If you're using vaginal dilators, the national recommendations suggest that you begin using your dilators 1 to 2 weeks after you've completed all of your radiotherapy treatment. They should be used on alternate days, so approximately 3 times a week, and they should be used for between 5 and 10 minutes. Evidence suggests that scar tissue may develop for up to 5 years after you've completed your treatment, and therefore we recommend that if you're using dilators, you continue use for at least 5 years or for longer if you wish to maintain a healthy vagina. We recommend that with the vaginal dilators you use a water-based lubricant which will make the insertion of the dilators as comfortable as possible. If you experience any discomfort or bleeding, then it's important you speak to your healthcare professional, either your nurse, doctor or radiographer.
The conditions that trainers would be very useful are where women have sexual functioning difficulties or issues. Now those might be vaginismus, which is the involuntary muscle spasm, which can make penetration almost impossible. So very often they may be non-consummated marriages for that reason. There could be issues to do with pain or referred pain, so a woman has a memory of pain and therefore she perceives that sexual intercourse is going to be painful for her. Or the type of woman who has vulvodynie, which is a non-specific pain which is around the vulval region and is triggered sometimes by touch response, and this doesn't actually show up as an inflamed or swollen area, but nevertheless is a very painful condition for some women, and they can be helped by the use of trainers. Sometimes I see women who are in the menopause or just through it, and the menopause through the loss of estrogen can cause some problems in the vaginal area. So that could be dryness in particular, or loss of elasticity of the vagina. So that these women may have, the walls may get thinner. So with the use of trainers, they can regain some of that suppleness. There is a difference between dilators and trainers. Dilators, by their word, means to stretch. But as a sex therapist, I'm looking at retraining and giving new muscle memories to these women. So they've actually got to learn a new way of receiving something to the vagina, and therefore overcoming their muscle responses, really. So that's why I like to call them trainers instead. Pelvic floor muscles are really important, and I think before any woman starts to use any form of trainer, she needs to know how to do those exercises properly, and that she's confident and comfortable using them first, because that will be a very important part when she is shown how to use the trainer as part of a program to help her muscles relax so that the vagina can open and she doesn't experience pain. Pelvic floor exercises. Now these are very important actually, because over 1/3 of women, when they start to use them, end up using the wrong sets of muscles. Now they're a sort of crisscross of muscles in the perineum and in front and behind the vagina that are used to hold everything in. So especially if you're having a baby, that's what stops everything all sort of falling out. So that they're a very important set of muscles. Now, how do you identify which ones to tighten and which ones to relax? Well, when you feel you want to pass urine, the thing to do is to go and sit on the toilet. And when you start the flow of urine, you are relaxing those muscles. When you stop the flow of urine, you are tightening those muscles. A woman doesn't necessarily need to see a sex therapist in order to use trainers effectively. She and her partner could learn to use them together, or she could do it herself. And it's a series of steps, progressive steps. And I think this type of training video will be very helpful for her. When a woman wants to start using trainers, it's important that she realises that she has the control for what is actually going to be a programme that she's going to go through. So she works out the steps she's going to do, when she's going to do them, and how she's going to do them. So she sets the pace. She then learns how to do her pelvic floor exercises, because what she's actually going to learn to do is to override a reflex reaction of her body. So the anxiety that she feels will then put in this reflex action. So the less anxiety she feels, the more she'll be able to relax, and then she can progress through the programme. So it's important that the woman learns to relax herself, that she's in a situation where she's undisturbed, she's not hurried, and she's nice and warm and comfortable. That's really important. So when she starts to use the trainer, she uses the very smallest one first. When a woman starts to use a trainer, it's important that she uses plenty of lubricant. And the lubricant that she uses, I like to suggest is thicker rather than a thinner water-based one, so and a very aqueous one. So what she does is she takes the lubricant and she puts it all over the outside of the trainer. The first trainer she's chosen is the smallest one. She then, I'm going to be using my hand to symbolise a vagina. She just puts lots and lots of lubricant on the outside of the vagina and just a little bit at the entrance, just like that. So there's plenty of lubricant. Now the idea is to take a deep breath in and then let the pelvic floor relax and offer the trainer up to the vagina. And if you're nice and relaxed, the trainer should slip just easily in. And then hold it there, take a deep breath, and let the pelvic floor relax again. Through a progression of steps, the woman can then go from that small size through to the next size and on through progressive steps to the larger and eventually the penis-sized trainers. It's important when you want to progress to the next size up that if you're comfortable with this size, that in the same session you progress to the next size up. The vagina is already relaxed and accepting of the first size, and it may well be more than ready to progress to the next size.
I'm Fabia Brackenbury, and for the past 13 years I have been running the National Lichen Sclerosis Support Group, and I have myself had lichen sclerosis for 16 years. Lichen sclerosis is a chronic inflammatory skin condition which mainly affects the female genitalia, and the main symptoms are itching, soreness. Sometimes the skin just breaks open and tears, and it can also make physical contact with your partner very difficult. One of the other things that can happen is that as time goes on, particularly if intimate contact isn't maintained, is that the vaginal opening can narrow, and that makes intimacy even more difficult. So one of the things that you can do to help relieve this situation is to start a course of vaginal dilators. So although we're talking here about lichen sclerosis being mainly a skin condition, so it's affecting the outside genitalia, it doesn't affect the vagina. However, it does interact with the opening of the vagina. So we're looking here now at thinking about stretching that back to a size that's going to make life more comfortable. So this is also in relation to cervical smears. So a lot of people on my helpline phone me. They live alone, they don't have partners, and they're horrified to find that when they go for a cervical smear, the nurse can't insert the speculum. And then very often they're also diagnosed with lichen sclerosis if they don't already have that diagnosis. So then it's a question of getting that opening to work again. So they may be offered vaginal dilators. And the way really to negotiate this is to enter the whole process in a relaxed way. You're going to be feeling probably quite tense. So it's good to find a nice quiet place on your own. Be comfortable, be warm. If you need soft music, if you can also regulate your breathing, calm breathing, take things very slowly, and depending on the degree of closure of your vaginal opening, you can start with a very small size dilator first, and always use plenty of lubrication. And lubrication is definitely a matter of personal choice, particularly with lichen sclerosis, because sometimes the skin can be irritated or affected by the sort of product you use. So you need to do a little bit of experimentation and find the thing that suits you best. And then make sure that you're really well lubricated, that your dilator of choice is going to be well lubricated, and start gently. Now, there is no real need to insert the dilator all the way into the vagina, because you're basically working on just stretching the outside. So probably inserting for about 1 inch to 2 inches, and maybe not that much if it's uncomfortable. And repeating that several times a week until you feel comfortable, and then move up to the next size until eventually, in your own time and over a period of time, you've got the vaginal opening back to where it should be, or certainly a more comfortable place than you're starting out. One of the other really good things about using dilators is that if you are in a relationship and things have become tense between you and your partner, if he's afraid of hurting you, or if you're afraid that you'll be in a situation where you're both feeling very passionate, but actually then you're worried there's a situation where he's not going to be able to penetrate, then you can work with the dilators on your own, and it will give you the confidence to know that you're actually capable of taking that sort of size. When you get to the largest dilator, you're getting really close to being at a good place to have penetrative sex. So it's all a matter really of not feeling fearful, because at the end of the day, this is your body, and this part of your body was given to you for this purpose. So whatever fears you have, this is a natural process. It's very natural for a woman. So just take it easy, do it slowly and in your own time, and it will perhaps sometimes. Some women take maybe 6 weeks. I have women who phone me and they say, I'm using the dilators, it's wonderful. In 6 weeks I'm back to normal and my partner and I are really thrilled. And for other women it might take a little bit longer. So there really are no hard and fast rules except to work with it as it suits you.
I'm Bridie Nelson and I'm founder member of UK Lichen Planus. Lichen planus is a chronic inflammatory skin disease which affects men and women. It affects many areas of the body and can be affecting 1 to 2% of the population at any time. The variations of lichen planus are non-erosive and erosive. The symptoms of vaginal and vulval lichen planus in the erosive version is pain, burning, soreness. Sometimes women medicate for thrush, over-the-counter remedies, but often they don't work, so they go to the GP. Another of the main symptoms for vaginal LP is mucus discharge, and of course intercourse is very painful. Sometimes it's impossible. What can happen if you're not properly medicated and treated is that there is the risk of scarring and fusing in the vagina and the vulval area. Surfaces fuse together and sometimes urethra is involved, and that can make spending a penny very difficult. And so not all women, I must say, have the extremes of this, but it can have a very devastating effect on intimate relationships. In extreme cases, operations are sometimes needed to open up the vagina, and after surgery the use of a dilator is really useful because it helps to keep things open during the healing process. But surgery is not always needed, and sometimes a dilator is very useful to stretch the vagina, and it helps with the narrowing, which sometimes occurs with lichen planus. It's really important that once your lichen planus has been diagnosed that you regularly self-exam for any changes that might take place, and that's the case with all vulval conditions. But basically it makes sure that nothing nasty happens, and that you make sure that any changes that do take place get reported back to your GP as soon as possible.
The Femax Vaginal Dilator is an NHS innovation and was invented by Joan Thomas, a Macmillan Gynae oncology nurse, during her time at New Cross Hospital in Wolverhampton. The Femax Dilator can be used after undergoing pelvic radiotherapy or for conditions such as lichen planus and lichen sclerosus. It is also commonly used as a training aid for those experiencing sexual difficulties or undergoing psychosexual therapy. The Femax Dilator can also be used after male to female gender reassignment surgery. The Femax Dilator comes in a discreet case and is available in a choice of colours, pink, beige or brown. You should always use your Femax Vaginal Dilator or trainer as advised by your health professional. You may want to follow these tips to aid relaxation when using your dilator. Create a relaxing environment. You may find it helpful to have a relaxing bath first. Choose a private place in your home, away from distractions or interruptions. Scented candles may help to create a relaxing atmosphere. Playing your choice of relaxing music may also help. This DVD contains instruction and helpful advice from a variety of experts. Each video will look at different conditions that can benefit from the use of a dilator. Simply select a chapter from the main menu or even play them all together. This simple yet practical innovation, invented by Joan Thomas, is yet another example of how inventive people are in the NHS in their desire to improve healthcare. These practical advances can only happen if NHS staff have the confidence to voice their ideas, if those good ideas receive active, enthusiastic professional support provided by NHS innovation teams, and the NHS collaborates with capable commercial partners such as MDTI. This is what we can achieve when we work together.